Tonight, from Keloland Media Group, a Health Beat special, COVID and Schools.
Good evening, I'm Sophie Heineman. Thanks for joining us tonight for a Health Beat special focusing on students, schools, and COVID-19. All across Keloland, students are back in the classroom, and while that's a positive sign after the school year was cut short in the spring, things are far from back to normal. Tonight, we will look at some of the best practices for students to protect against the coronavirus. We'll find out what parents can do to help their children to not get overwhelmed by the stress and uncertainty of COVID-19. And from immunizations to sport physicals, why it's important to not let your students' health get lost in the pandemic. Tonight, we are joined by Chief Medical Officer at Sanford Health, Dr. Allison Suttle. Thank you for joining us.
Thanks for having me.
So, Dr. Suttle, most students have been back to school for less than a month, and we've seen a big increase in COVID-19 cases in South Dakota. So first off, let's look at where we're at right now in the pandemic.
So I think we need to look broadly about the pandemic, and the increase in cases in South Dakota and North Dakota and Minnesota and Iowa really is how the virus spreads and how the pandemic occurs. Starts on the coasts where people travel and come from abroad into our country, then goes to the populated South, and then comes to the Midwest. So I think we anticipated that we would have more cases, and we certainly are seeing that. Thankfully, as a health system, we know how to diagnose and treat this illness. So we feel very confident in the supplies that we have, in our ability to take care of patients. We have adequate, more than enough of what we need to be able to manage those patients that get particularly ill and end up in the hospital. Most of those increase in numbers, obviously, is the younger individuals. In fact, we've seen, compared to February, those that are diagnosed with COVID right now, about 54% of them are under the age of 30.
And Dr. Suttle, it's not just K through 12 students. Right now, the age range with the most cases is people in their 20s. Are these numbers you expected to see as school started?
Yes, they are numbers we expected to see. Thankfully, most of those individuals that are in that younger age group are healthy individuals that have kind of that viral illness, respiratory viral illness with fever, dry cough, not feeling well for a couple days, but then they rebound and kind of get back to normal. That's not 100%, but that's the vast majority.
At last report, 187 South Dakota schools have students or staff members who have tested positive for the virus. The health department says there are 452 cases, including nearly 300 students and 155 staff members. All of the state's public colleges and universities are dealing with COVID-19. The state says there are 842 total cases, and most of them are students. So what can young people, specifically college students, do to help keep these numbers down and slow the spread of COVID-19?
Yeah, so I think it's actually a good thing that we're finding these cases, that we're diagnosing it, and that we're getting people into quarantine and into isolation. So just having large numbers isn't a bad thing. It means we're finding the cases and we're isolating individuals. I think the biggest thing for college-age kids is to not blow off or not disregard a low-grade fever or not feeling quite right. Take it seriously. It's not just for you, but it's for your colleagues. If you're all there because you want your education, you want to be on campus, then take those symptoms seriously and stay in. Don't, break the rules and get together in large groups of people. It really takes everybody doing their effort because it's so important that those kids are back on campus getting their education.
And if a student is exposed in the classroom, what do you recommend for a family in terms of quarantine? Does everyone in the family do the 14 days or just the student?
So I tend to just say just the student. So there's usually not a second degree exposure. It's only a first degree exposure. If I've been exposed, then I'm the one that has to quarantine. My family, while I'm in quarantine, we shouldn't stay super close together, and I should kind of stay away from them, that 6 feet, wear a mask if I'm really close with them, but they do not need to quarantine. Otherwise, we'd keep quarantine more and more individuals. So it's really just those with direct contact that need to quarantine for 14 days.
And what's your advice for teachers and school officials, both in and outside of the classroom?
I'm so proud of our education and system and what the teachers are doing and the plans that they're creating. I think just like nurses and doctors having to go to the front lines, the teachers having to go to the front lines are really the kind of the new heroes. And I think it's just that positive peer pressure of wearing masks and doing all those things that are the public health things that we need to do to try to maintain those in the classroom is the best that we can do to prevent the spread, at the same time educating our children.
All right, thanks a lot, Dr. Settle. We are going to take a quick break. We'll be back with more from Dr. Settle on what parents can do to help children deal with the stress of a pandemic. Plus, when it comes to kids, keeping a mask on can pose some challenges. We have advice on how to make mask wearing more comfortable for your child coming up.